The devastating impact of betrayal on trust and reality. Introduction. Trust is the quiet foundation of our daily lives, a necessary ingredient in every relationship that stabilizes our perceptions, emotions, and social bonds. When trust is deliberately or inadvertently shattered, the psyche reacts as if it has been exposed to a potent psychoactive agent. The emotional fallout is not fleeting. It can prompt long-term trauma, incite paranoia, dismantle our sense of reality, create disruptive delusions, and push us towards simplistic, conspiratorial explanations for life's uncertainties. Trust as the foundation of reality. In healthy relationships, trust acts as an unspoken contract that reassures us that the world is predictable and that our perceptions are valid. This secure base allows us to navigate our environments with confidence. Conversely, when trust is destroyed, our mental scaffolding begins to crumble. The loss of this stability leaves us feeling uncertain, abandoned, and fundamentally unsafe. This erosion of credibility in our closest bonds undermines our overall belief in reality, forcing us to question the validity of our experiences. The neurobiological impact of betrayal. Betrayal is more than an emotional setback. It is a neurobiological insult. Research shows that the brain processes betrayal similarly to physical pain, firing stress hormones and activating neural circuits dedicated to threat detection. This heightened state of alert disrupts normal cognitive functions and alters emotional regulation, paving the way for chronic anxiety and a persistent sense of vulnerability. The body's prolonged stress response can imprint deeply, contributing to conditions such as post-traumatic stress disorder, PTSD, and other trauma-related disorders. The descent into paranoia and distorted reality. The immediate aftermath of betrayal often gives way to a pervasive state of paranoia. With trust shattered, the mind becomes hypervigilant. Every benign gesture or remark is scrutinized for hidden malice. Over time, this chronic suspicion can distort the individual's perception of reality. As ordinary events morph into perceived threats, the boundary between rational thought and irrational fear blurs, creating a fertile ground for delusional interpretations. This disintegration of objective reality not only isolates the individual, but also corrodes the foundation upon which healthy interactions are built. The allure of conspiracies. In the search for meaning amid chaos, many individuals find temporary solace in conspiracy theories. When the trusted sources of truth crumble, these theories offer clear, unequivocal explanations, even if they are oversimplified or entirely false. By attributing personal pain to nefarious external forces, individuals can externalize their trauma, regaining a semblance of control in a world that suddenly appears unpredictable. However, this coping mechanism comes at a steep price. While a conspiracy may provide immediate psychological relief, it often further alienates the individual from reality and reinforces a cycle of fear and isolation. Forms of psychosis induced by betrayal. For some, the psychological blow of betrayal escalates beyond chronic stress and delusional thinking into full-blown psychotic manifestations. While not every betrayed individual experiences psychosis, those who are predisposed or exposed to repeated betrayals may develop one or more of the following. Paranoid delusions. A heightened fear of further betrayal can evolve into fixed, irrational beliefs that one is being targeted. These delusions are characterized by persistent mistrust and the conviction that hidden enemies exist in every social interaction. Dissociative episodes. Facing overwhelming betrayal may trigger the mind to disassociate, a defense mechanism where the sense of self or the continuity of memory becomes fragmented. In extreme cases, these dissociative states resemble psychosis, where the boundary between one's internal identity and the external world becomes severely blurred. Transient psychotic disorders. Acute psychological stress from betrayal can precipitate episodes marked by disorganized thought, perceptual distortions, and a profound disconnect from shared reality. Even when brief, these episodes signal how deeply betrayal can undermine the stability of one's mental landscape. These forms of psychosis underscore the severe ramifications that betrayal can impose on the mind, altering not only how individuals feel and think in the moment, but also how they interact with the world over the long term. Pathways to healing and rebuilding trust. Despite the profound psychoactive effects of betrayal, recovery is possible. Healing requires a multi-pronged approach that addresses both the emotional trauma and the cognitive disruptions. Therapeutic interventions, trauma-informed therapies, such as cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT, can help individuals dismantle the irrational beliefs arising from betrayal and re-establish accurate perceptions of reality. Reinforcing social support. Cultivating relationships with trusted others or professional support networks provides a secure environment for restoring trust. These supportive connections help counterbalance the isolation and fear that betrayal instills. Mindfulness and self-reflection. Practices like meditation and mindfulness enable individuals to observe their thoughts non-judgmentally, fostering a reconnection with the present moment. This reconnection can gradually disarm paranoid ideation and re-establish a coherent sense of self. Conclusion. The destruction of trusting relationships unleashes a cascade of psychoactive effects: long-lasting trauma, pervasive paranoia, reality distortions, delusional constructs, and a retreat into conspiracies. Yet, amid this psychological upheaval, there exists a path to recovery. Through professional intervention, supportive relationships, and mindful self-reflection, individuals can rebuild the core of trust within themselves and their communities. In doing so, they not only recover from past betrayals, but also restore a vital sense of reality and personal agency.